It's incredibly distressing for patients to have to deal with hair loss and then the result of a bad hair transplant. We often see patients who wish they could turn the clock back and just accept hair loss because they're finding the results of a bad hair transplant to be so much harder to live with than just being someone who's thinning. It's possible to help patients to repair previous bad work. There may be scarring, there may be redness, there may be irregularities to the skin, and there almost certainly going to be large, thick, multiple haired grafts sitting in a hairline. Very often the hair transplant has been done in a way that the hairline is wrong, so the shape may be wrong. It comes and curves around at the corner, something that patients think is going to look youthful, but actually just looks unnatural. Very often it's not a hairline that a patient chose at all. I hear stories of patients having hairlines designed as they walk down the corridor to the treatment room. There's not the effort and the attention to create something that's going to be natural for them as an individual. When I'm looking to repair a transplant, there are options to remove the existing hair if it's been put in wrongly or in the wrong place. And that can be me using an FUE punch device to remove the hair. It's important to understand that will leave scarring, but the scars tend to be far better to look at than the misplaced, unattractive hairs. We have lots of results of patients who've been through the repair process with me, and it's amazing how well the skin can heal and how flat and subtle the scars can be from an FUE punch-out from a misplaced graft from previous surgery. I can reuse the hairs that I punch out from a hairline to thicken hair elsewhere. One of the big challenges I have is that a bad surgery will often have taken far too much hair from the donor. There will be often very thin, patchy looking hair at the back and the sides of the head, leaving me very little to work with to thicken a result. Often the best result will come from removing the old grafts, creating a more natural looking shape to the hairline and softening the hair by placing some very fine hairs in the hairline in place of the hard, harsh, pluggy grafts that were there from before. It's very important to understand that you can't always fully reverse the results of a bad hair transplant. I'll do my very best to remove the hair and to create beautiful healing and scars that are very subtle to see, but irregular, thick scars or red, raised skin can be improved but will never be quite the same as it was before in some patients.